subsections. Today is the inaugural section of the day. On this very auspicious day, I welcome again Dr. Shrikumar K, Professor and Head, Department of Rachana, Sharir, Prasanna College of Ayurveda and Hospital, Belthangady, Karnataka, India. Its topic of research today's presentation is Foundation of Ayurveda, its meaning, purpose, and scope. The analyst of today's lecture, Professor Dr. K.E. Dharanidharan, Department of Sanskrit, Pondicherry University, and special guest of today's lecture is Professor Dr. Taraknath Adhikari, Department of Sanskrit, Rabindrabharati University. I heartily welcome again all of you, sir, on behalf of Kulti College. Now, formally, I open the discussion for 7 days workshop. Over to Shubhankar.
Thank you, sir. We are honored to have among us our special guest, respected Guruji, Professor Dr. Taraknath Adhikari. He is a retired professor from the Department of Sanskrit, Rabindrabharati University, Kolkata. He is a scholar in the field of Vedas, Sanskrit, literature, manuscript, Ayurveda, and various branches of Indian knowledge system. Now, I warmly invite respected sir to kindly deliver his valuable address. Sir. Sir,
Taraknath sir is here?
I think so, yes, sir.
Yes, sir. Yes, sir. Yes.
Yes.
Welcome, sir.
Yes. Thank you.
Namaste, sir. Namaste.
Namaste, sir.
May I start my lecture?
Yes, sir. Yes, sir. Yes, sir.
Om Nupam Karoti Vachalam Bangum Langhayati Girim Yat Kripatamaham Bande Paramananda Madhavam Padashivasmaramham Sankaracharya Madhyamam Asvatacharya Parjantam Bande Guru Paramparam. Respected Professor Dharanidharan of Pondicherry University, all respected the principal sir, and my student and the teacher of Kulti, the assistant professor of Kulti, Shubhankar Bosak, and so many scholars from all over India, and all the distinguished listeners. First of all, I would make it clear to all the listeners that am I audible?
Yes, sir. Yes, sir.
Yes.
I would like to make it clear that I am not at all a specialist on Ayurveda, and at the same time, the system of Ayurveda is so intricate, so what I would say, suksmam, so abstruse, and it needs at least a number of years to learn the Ayurveda system of medicine. Even then, out of love and regard, Dr. Shubhankar Bosak has invited me to speak on Ayurveda system and Indian knowledge system. 2 or 3 things I would make it clear that Indian knowledge system, IKS, and at the same time, the Ayurveda system, both are some sort of what I would say, it is not always a matter of very easy thing. What I would say, what we are doing so in Indian knowledge system, that is Indian knowledge tradition. That means throughout some 4 or 5,000 years across India and world, what we have been done in last 4 or 5,000 years in our uh, Indian thought-provoking systems, that has been uh, embedded in our literature, right from the Vedic literature to so many systems of literature. It may be science, it may be literature, it may be aesthetics, it may be alankara, it may be the sculpture, it may be the architecture, it may be the engineering system. Anywhere, any system, what a society and a culture can deserve, all has been preserved in our old knowledge systems. And what we are doing, that is, we are rediscovering, we are retranslating, we are reinterpreting all the things, all these areas of knowledge systems, that is to be called the Indian knowledge system. And in this system, Ayurveda is one of them. Yes. My kind listeners, you will know that Ayurveda is a very old system of treating disease. But at the same time, we know that in our Ayurveda books, particularly in Charaka, in the first Sutra Sthana, they have detailed about the mythical development, origin and development of Ayurveda. It's okay, fine. But at the same time, we'll have to understand that whether as Vedo Akhila Dharma Mulam, and I would revise this word, Vedo Akhilo Gyanamulam. That means in the Vedic literature, all the knowledge system, it may be Indian philosophy, it may be Indian science, it may be Indian literature, it may be anything else what a society can do. All has in Bija system, we can head off in our in the Vedas. So if I would start, as I am a student of Veda, if I would start with the Vedic knowledge on this particular area, and if they have any contribution, our Vedic rishis on the system of disease, on the system of the curing of disease, I hope it will be very clear to you. Okay.
Yes, sir.
In the Vedas, actually, when Charaka and Shushruta itself, they have recorded in their books that Kong Vedam Srayati, that means upon which Ved we discussed on Ayurveda. Both of them has recorded that Atharva Vedam Ittahu. That means that our system of Ayurvedic knowledge is based on Atharva Veda. It's okay, fine. So we have to find out whether actually in the Atharva Veda we have anything else on the Ayurvedic system or Ayurvedic knowledge or disease system or curing system, etc. If it is at all there, we'd find that some systems are there, were there in the Vedic literature. Yes, right from the Rig Veda, we can find it that the rishis says that Satam te bhishajah rajan sahasram te urvihi. That means even at the time of Rig Veda, Satam te bhishajah rajan, there are hundreds of physicians and thousands of medicinal herbs were there, even in the Rig Vedic period. So, rightly, our Charaka has mentioned in his book, Nakaschit Ayusha Santana Asti. That means that there is no starting point of, we cannot say that one has invented the Ayurveda. We cannot say. So, even in the Rig Vedic period, there are hundreds of periods and hundreds of systems of treating disease. With the Vedic scholars, even the students also know that there are curing the Ashini Devata, two twin gods, Ashini Kumar. They were the divine physicians. They used to treat. Even there is a story of Vishwala and Mudgala, where we had seen that they have once Vishwala actually see that the girl, she went to where? Yuddha Kshetre Sa Gata, and she lost her leg. And Ashwini Kumar, interestingly, we cannot challenge how did they do it. Ashwini Kumar has amputated her leg and put the Kritrim leg to Vishwala, and so absolutely correctly that Vishwala again went to the battlefield. This has been recorded in the Rig Veda. We cannot say that rishis have said lie. So we have to believe that there was a system of medicine in the Rig Vedic period too. Again, now coming to the Atharva Veda, I have been reading a paper on Professor Deepak Bhattacharya, who was a very renowned scholar of Atharva Veda. He has written in his paper that the main system of treating disease, or the main concept of Ayurveda, that is Vayu, Pitta, and Kapha. That means Tridosha Tattva. And I would just show one book here, The Principles of Tridosha Tattva in Ayurveda by one Kaviraja, Dhirendranath Rai, written so many years ago and published from Rashtriya Sanskrita Sansthan. He has written about the Tridosha Tattva very minutely and informed us that this system is so abstruse, so difficult to understand, that simply understanding the Vayu Pitta Kapha, that means the air, the knowledge of air, the knowledge of Kapha, Phagrum, and the and Pitta system is so difficult to understand that we cannot grasp it in so easily as he has written throughout in his work. And Professor Deepak Bhattacharya, he has contested in his paper that in the Atharva Veda or in the Vedic literature, there is no reference of Tridosha Tattva. That means that is the cardinal point of Ayurveda cannot be found in the Atharva Veda. In one of my paper, I also somehow challenged his concept, and I have shown from S.N. Dasgupta's book that S.N. Dasgupta has written that in Indian system, in the Vedic time, there was a theory of Tridosha Tattva, that is Vayu, Pitta, Kapha. Maybe in the other name, not maybe in the Tridosha system, but Vayu, Pitta, Kapha was accepted in any way in the system of Ayurveda. He has mentioned, and we can find it in the Atharva Veda, that Bhataja, Abhraja, and Jalaja. All these three systems, they can be the cause of our disease. This has been clearly written in our Atharva Veda, probably chapter 2 or chapter 5. Anyway, so now if we come to the Atharva Veda, we can divide it into three periods. I am speaking about the historical origin of the Ayurveda system. So if we divide into three grand divisions, one first 7 khandas, and it has 20 chapters, and second 8 to 12, and from 13 to 18 or 20th chapter. These three grand divisions, and out of three grand divisions, the first grand division, that is totally, mainly, chiefly on Ayurveda system, and that's why in everywhere Atharva Veda has been accepted as a Bhaishajya Veda, particular for these 5 chapters. And there were another name of Atharva Veda, or another school of Atharva Veda, that is known as Charana Vaidya. That is, Charana Vaidya means wandering physicians. Those the physicians who used to go from here to there, from one place to another place, to treat the patient. So there were, in the particular Atharva Vedic system, where the system of Ayurveda, so the system of treating disease, existed. And what I say in treating the disease, the Atharva Veda has mentioned, and if we say Tanda Mahabrahmana's record or Gopada Brahmana's record, we'll find these lines. Bhesajang Boi Atharvani. If we speak about the herbs, if we speak about the medicinal herbs, we have to go to the Atharva Veda. And Gopada Brahmana further said that Jad Bhesajam Tad Amritam, Jad Amritam Tad Brahma. They have reached in the Charaka system. We would see that they treat not only the disease, they treat the total human being and human soul. And if we go through the Atharva Veda's primary books, the first systems, we will see that they have mentioned in very clearly that when we speak about the name of Ayush, Ayurveda Ayush, they have mentioned Sarirendriya Sattatmaka Sattatma Sangyoga Dhari Jivitam Nityascha Anubandhascha Parjayai Ayurucha. What is Ayu? What is Ayush in Ayurveda? They have said that Sarira, that means body, Indriya, that means senses. Shatta, in Ayurvedic concept, it is mind. And Atma, soul. These four elements constitute the I. And in modern system too, we can see that the body, the senses, and the mind has been accepted regarding the anatomy, regarding the concept of disease. They do not accept the Atma because they cannot find it in their experimental system. But Ayurveda, but Charaka has mentioned, but four objects are to be treated when we treat a patient, and these four elements are known as Jivitam, that means Jivanam, and that means the Ayu. And anyway, Ayurveda has tried to treat Manushyanam Hitayu. Manushyanam Hitayu. That means the good body, mind, and soul is to be treated in the Ayurvedic system. And if we go to the first, the Ayurvedic system, we will find the very known line. Hitahitam sukham dukkham ayustasya hitahitam manam cha tatcha yatruttam ayurveda sauchate. This is the definition of Ayurveda. Hitahitam sukham dukkham ayustasya hitahitam manam cha, the standard of good health, the bad health, the standard of our happiness and sorrow, the standard of the hito or ahito of human being, where all these are treated, that is to be known as Ayurveda. So we can find in the Atharva Veda all these things. I would mention one or two important things. Nowadays, what we see, the if we go to a physician, they ask us or ask or advise us to diagnose the disease. They send us to some pathological systems. That means some, maybe in blood, maybe in stool, maybe urine, maybe so many things. They are for pathological systems, and they want to see whether any the cause of disease has been done by any micro. That means microism. That means by a sukshma. That is what do you say? The onu, sukshma onu. That is the very small. They have told in their term, they have told it that it is the chatana, amoeba, or amoeba, chatana, or one thing that I could remember.
Minute.
Huh?
Minute.
Minute may be very small elements that causes diseases. That causes diseases, and they have said that these microsystems, what today is in laboratory, which are tested, that are new to them. Interestingly, how did they knew it? That is a matter of surprise. That is a matter of wonder. The knowledge, Indian knowledge systems, or those who are experts on Ayurveda, they will think about it. How did they recognize the sukshma elements, that is drishtascha, adrishtascha. Drishtascha, adrishtascha. There are they're causing the disease. What is a bacteria? I could not find the term. That is the bacteria. That maybe they have said the drishtascha, adrishtascha, sukshmascha. They were so obscure, so unknown, and it is known that we can say the bacteria, what we can see, that can be the cause of the disease. But at the same time, how did they discover the adrishtascha cremoya? Right, they have used the term creamy. Drishtascha, adrishtascha cremoya. Creamy, these the small elements. So how can we find? How did they find out the adrishta? And they have caused it. They attack us. The Ayurveda says they attack us through our noses, through our eyes, through our ears, through our mouth, and they attack our brain, attack our heart, and attack our so many body parts, and they cause diseases. And they have mentioned the herbs, the chanting of the mantras, the various types of medicinal properties, and that could be found in the Ayurveda, by which they used to treat it. But at the same time, in one text, I would say, in the Ayurveda, in chapter 10, we have a big a number of hymns, a number of verses, where we can find. May I have to finish? May I have to finish it?
Yes, sir. Yes, sir. Yes, sir. Actually,
Oh,
sir, our
time is going out. Yes, time is going out. Okay, let me give 5 or 7, 5 minutes, then I will finish.
Okay, sir.
In a complete system of anatomy is to be found in the 10th chapter of Ayurveda. At the same time, in Garbha Upanishad, there is a small Upanishad known as Garbha Upanishad, where we can find a total system of embryology from conception of a woman to giving birth to a child. All systems are depicted in Garbha Upanishad. You can find it. But one missing point is there in the Vedic system and the Ayurveda system. There is a missing link, and those who are participated in the workshop, they will try to find out the missing link. That is what the Charaka or Susruto or Vriddhatrayee or Laghutrayee or the Ashtanga Ayurveda, what they have told. They are then in very widely about the disease, about the treatment, etc. They have emphasized on Vayu, Pitta and Cough. Vayu, Pitta and Cough, which are not exactly to be mentioned in the Vedic system. And Charaka has mentioned that due to the imbalance of these 3 systems, these elements, 3 elements, Vayu, Pitta and Cough, the bacteria grow up. And these bacteria cause disease. This is their system. And this is their researches. And in the coming discussion, and one thing I would say, and I will complete, that there was a time, some 5 years, 6 years back, what we call the Corona period. The coronavirus attacked us. And in the Vimana Sthana of the Charaka, there is a mention of some kinds of viruses. They are so abstruse, and they can cause epidemic. They can destroy a full Janapad. What has been done in the Corona, that has been mentioned in the Vimanasthana of the Charoko, and interestingly, they have mentioned it could be relieved only by washing hands, and to be cleaned always, to be kept our mouth masked. All these things has been mentioned in the Vimanasthana, and some people are trying to find out that this is that these epidemic diseases are has some relations with the coronavirus, or like these types of corolla viruses, which can annihilate a full Janapada, a city, a town, or village completely by these bacterial diseases, viral diseases. Anyway, I would not take much time. There are so many things in the Ayurvedic system that are not exactly are their Nidhanasthana, Sharirasthana, Indriyasthana, Chikitsasthana, Kalpasthana, Siddhisthana, etc. and treating by the Tridosha Tattva. I would request that this Tridosha Tattva and its relation with Sattva, Raja, Tama, and the viral systems or microsystems or privy systems, all these are to be chalked out. All these are to be discussed. All these are to be invented in a new way, that the Ayurveda system, what was actually once upon a time, yes, I mentioned with these things to end my lecture, that there is a misconception. There is a misconception, and it has been recorded in the misconception of whose report, 2005. And the report says that there is in India there was no systematic treatment system was there. They inherited it from Arab, and from it was came to Greece, and from Greece we have inherited the Ayurvedic system. Actually, this is a completely failure, completely misconception, completely misunderstanding for us, that has been recorded in the WHO, because the Arab system, because the Greek system, what is first, second century maybe, but our Charako or Susruto, they have started even 5th or 6th century BC, they have started, and Veda, that is some 2000 BC, 2500 BC, they have the systems of diseases. And Charako, if we take Charako Susruto as the systematic treatment of disease, that was started before the Buddhic Bauddha system. That means 5th or 6th century BC, we started our systematic medicinal practices very systematically, and that has not been mentioned in the WHO's report. This is a matter of sorrow for us. We have to discard these things in our workshop. I am grateful and I am happy to the organizers that they have invited me to give me the introductory lecture on this thing, and I am very happy that the principal sir and Mr. Professor Dharnidharan and so many scholars. I have heard that more than 300 persons have participated, 300 scholars have participated. They would discuss next 7 days on the Ayurveda system in Indian knowledge system, and find out and discard the uh, the the misconceptions, the views of Indian Ayurvedic system, from and rewrite the history of Indian medicine in a new way. Thank you very much. Thank you, everybody.
Thank you, sir. Many thank you. Now, we are deeply honored to have among us today our distinguished speaker, Professor Dr. Shrikumar, sir. He is a head of the Department of Rachana, Sharir, Prasanna College of Ayurveda and Hospital, Karnataka. He is a renowned scholar in the field of Ayurveda. He has authored many books, he has published many articles, and he has received many awards. Now, I warmly invite respected Dr. Shrikumar sir to kindly deliver his valuable space. Shrikumar sir. Shrikumar sir. Shrikumar sir. Just wait.
Hello, sir. Hello, sir.
Yes, sir. Yes, sir. Yes, sir. You can start,
Can
sir.
you hear? Can you hear, sir?
Yes, sir. Yes, sir. We can hear, sir.
Can you see my face?
No, sir. Only audio is coming, sir.
Video is not coming.
Yes, sir. Yes, sir.
Video?
No, sir. No video. Only audio, sir. Only.
Only audio. Video is not coming.
Yes, sir.
Why, sir? Something went wrong?
Okay, sir. No issue. You can start, sir. No issue, sir.
The video, you can see the video, sir, or not?
Not, sir. Only.
You can audio. It is audible, no, sir?
Yes, sir. Audible, sir.
What happened, sir? I will start.
Okay, sir. No issue, sir. You can start, sir.
Okay, sir. I will start. Om Shri Dhanvantare Namaha. Sarvebhyo Acharyebhyo Namaha. Sarvebhyo Gurubhyo Namaha. It's audible, no, sir?
Yes, sir. Audible, sir.
My voice
But
audible,
not-
sir.
Video is not clear.
Yes, sir.
Yes, sir.
Video is
Video
not
not
coming.
Video not visible.
Yes, sir. Yes, sir.
Sir,
Video is not coming.
Okay, anyhow, I will start, sir. I will start now.
Okay, sir. You can start, sir.
Video continue. Video 1 minute, sir. I will check. Video.
Okay, sir.
Hello.
This time.
Yes, now?
Yes, sir. Now it's.
Yes, sir. Yes.
Now visible?
Yes, sir. Yes, sir. Visible, sir.
Okay, sir. Thank you. Thank you. I will start now. Sorry for the disturbance. Good evening to all of you. Sorry for the disturbance. Ayurveda is having two words. One is Ayu and Veda. Ayu means Ayush or life of the man or any human being or any living object. Veda means the science. As you know, I do not want to describe more about Veda. Veda means science which is true during past, present, and future. In all time, true thing means it is Veda. What is Ayurveda means? Hitahitam sukam dukkam ayu tasya hitahitam manam cha tatya yatroktam Ayurveda savuchyate. Already our distinguished sir, he told about this particular thing. Now I will tell one more definition. They say, Ayushyani anayushyani, dravya guna karmani, yatra varnyante, ayurveda sa uchyate. Ayurveda tells ayushya, anayushya, that is the living being, and after the death also, how and what is the structure and function, whether it is going on there in the body, all these are described in Ayurveda. Hita, hitam, dukkam, dukkam. Hita and ahita, which is good for health, which is bad for health, which is sukha and which is dukkha. Hita, hitam, sukham, dukkam, ayu, tasya hita, hitam. And then mana. Mana means the measurement. Measurement has got very important part in Ayurveda. Each and every body is measured in the form of angula pramana. That is, particular proportion of the body and particular proportion of each and every part is described in the Ayurveda. This is manam chatacha yatroktaha Ayurveda sauchyate. Then ayushyani, anayushyani, dravya guna karmani. Dravya means all the things which are around us. It may be herbal, it may be animal, or it may be plant origin, or animal origin, or mineral origin. All these things we use for the medicine. Therefore, dravyani, ayushyani, anayushyani, dravya guna karmani. Guna. Each and everything has got particular guna. In Ayurveda, 20 gunas are told. As, like Guru, Lagu, like this. Ruksha, Snigdha, etc. All these gunas are described in Ayurveda. I will come and describe about it, gunas, afterwards. Then, why all these things are told means, Ayurveda is mainly concentrating the healthy human being. That is, swastasya swastya rakshanam, aturasya roganut. The healthy person's health is to be restored. That is the first part of Ayurveda. In modern science also, today, there is a subject called social and preventive medicine. This is very finely described in Ayurveda. As few minutes ago, sir told about the Janapadodamsa Roga, etc. I will describe it at the end. It is very fine. I will describe it. Then, first intention of Ayurveda is swastasya swastya lakshanam aturasya roganut. A healthy person's health should be restored, and afterwards, whenever he gets some disease, it should be treated. That is described in Ayurveda. How the treatment is done in Ayurveda means, one is preventive, another one is curative, and third one is palliative. The diseases, when our acharyas described the diseases, they have classified the diseases into sukhasadhya, kashtasadhya, asadhya, and yapya. Sukhasadhya means we can treat the disease within a few days with good medicines. Kashtasadhya means it will take a longer time to treat, but it is a little difficult to treat. And asadhya means we cannot treat, we cannot help the patient. He will go to die. Yapya means the disease will be there along with the person till his death. That is, living with the disease. What we can do with this, our acharyas tell, is if there is a disease to a person and it cannot be treated, we can give him a better life. We can give him a better life. That is very, very important. That is the way of approach of our acharyas. Sukhasadhya, kashtasadhya, yapya, asadhya. These are the classifications of the disease. Similarly, what is the body? How it is made out? That's very important. That's it. Rachana, Sharira, or structure of the body. Shariram adhikrityam kritam tantram shariram, Rachana pratipadakam shariram, Rachana shariram, Kriya pratipadakam shariram, Kriya shariram. This is the anatomy and physiology is described very finely in Ayurveda. For example, he has described all the bones, all the structures of the muscles, number of muscles he tells, and number of ashayas or the parts of the body, like that. Everything it describes. Similarly, the kriya or the function, it describes very nicely the respiration, how it takes place. For example, in a book, it describes Nabhistaha pranapavanam spruhtva sitkamalantaram kantat bahirviniryati patum vishnupadamrutam pitvacha ambara piyusham punarayati vegatha penayan dehamakilam jivayancha jataranam. This is the description of inspiration and expiration. But expiration tells Nabhistaha pranapavanaha, the pranavayu. There are three doshas. Among one is Vayu. The classification or classification are categorized into 5 types of vata. That is pranavayu. It comes from Nabhi. Nabhistha pranapravanam spruhtva kamalantaram kantat bahirviniryati patum vishnupadamrutam pitvacha ambara piyusham punarayati vegatha prenayam dehamakilam jivayanta jatranalam. See, imagine the air comes from Nabhi, gets out through the mouth, and once again it captures Vishnupadamrita, means oxygenated atmospheric air, and goes inside and it touches the heart. Imagine, it goes to the lungs. From the lungs, it goes to the it goes to the heart. Spruhtva sitkamalantaram kantat benirvinayati patum vishnupadamritam pitvacha ambara piyusham punarayati vegata prenayan dehamakilam. It circulates all over the body. Such a beautiful description is there regarding physiology. One anatomy and physiology, and I just completed. I will tell about the pathology and other things afterwards. See, now, next we have to see what is swastha, who is healthy person. Who is healthy person? He describes. He describes who is healthy person. Samadoshaha samagnishcha samadhatu malakriyaha prasanna atma indriya manaha swastha iti abhidiyate. His doshas. Doshas, as I told, there are 3 in number: vata, pitta and kapha are the dosha. Samadoshaha, samagnishcha. His agni should be in the equilibrium position. Samadoshaha, samagnishcha, samadhatuhu. The dhatus, which are the dhatus, he is telling. Sorry, some disturbance. Sorry, sir. One patient was calling. Yes. Samadoshaha, samagnishcha, samadhatu malakriha. Samadhatu, there are 7 dhatus in the body. They are rasa, rakta, mamsa, meda, asti, majja, and shukra. This can be compared with the tissue elements today. Samadosha, samagnishcha, samadhatu, malakriyaha. In Agni, Agni means Jatragni and all the Agnis present in the dhatus. That is, whole metabolic system he is telling as Agni. Samadosha, samagnishcha, samadhatu, malakriyaha. The defecation and or urination or sweating, this should be in the proper manner. Samadosha, samadhatu, samagnishcha, samadhatu, malakriha, prasanna atma indriya manaha. This is very important. He should be prasanna atma. His soul should be happy. Manas should be happy. His indriya should be happy. Indriya prasannata, mana prasannata, and atma prasannata should be there. Then only he is considered as a swastha person. But in modern science, he is free of disease, means they consider him as healthy. But here he is not healthy if he is having any one or more of the problems. Samadosha, samagnishcha, samadhatu malakriyaha, prasanna atma indriya manaha, swastha itya vidiyate. Now, what happens if this doshas are vitiated? For example, vata, pitta, kapha. What happens when they are vitiated? When he is describing the vata, pitta and kapha, our acharyas describe very finely. They tell, kapaha pango, pittam pango, pangavo, maladhatavaha, Vayuna yatra niyanti tatra gachanti megavati. Very beautiful description. Kapha is also pangu, it cannot walk. Pitta is also pangu, it cannot walk. But Vayuna yatra niyanti tatra gachanti megavati. All the dhatus are also, they cannot move from one place to another place. Vayu is taking them from one place to another place. Vayu is very important among doshas. When we talk about the Trimurtis, they fight. Who is first, who is second, or last. Everyone is important. But similarly here, all the three doshas are important, but Vata is supreme. And the diseases which are seen because of the vitiation of Vata are more, 18 numbers. Diseases vitiated by Pitta are 14 number, and diseases vitiated from Kapha are 20 number. 80 Vata Jarogas, 40 Pitta Jarogas, 20 Kapha Jarogas. Therefore, Vata is a dominant. According to the dominance of dosha, his prakriti will be decided. Shukla Shonita Samyoge, Yo Bhavet Dosha Utkataha, Prakriti Jayate Tena. When Shukla and Shonita are getting together, which dosha is dominant, that is seen in the next progeny. Very important things. I have noticed in my practice several important things. For example, Caesar, see all of you. One father has 10 children means all the 10 children are not similar. Same couple is having 10 children means 10 are not similar. But 1 or 2 are similar in that among them. Out of 10, 2 or 3 may be similar. But there may be some similarity. Because Shukla Shonita Samyoge Yo Bhavet Dosha Utkataha Prakriti Jayate Tena. Very nicely it is described. Imagine the concept of our acharyas. For example, these doshas are changing from time to time in a person's life. And doshas are changing from season to season. For example, Shishiro Vasantasya Grishmascha Varsha Sharadi Hemantaha. These are the Rutus and Masas. Here, in some Rutus, some doshas are more in the body. At that time, if the baby takes birth, the baby will be having a different look. Shishira is different, Vasanta is different, like that. Shukla Shonita Samyoge, Yogave Dosha Utkataha, Prakriti Jayate Tena. This is described in Ayurveda. This is the beauty of our science. Then, how this changed means, according to the place, it is changed. Jangalam Vatapuishtam, Anupantu Kapolbanam, Sadharanam Samamalam, Tidya Bhudeshamadishet. It tells Angala Desha is Vatapuishta, there Vata is more. Anupantu Kapolbanam, in Anupadesha, there will be Kapha dominance. Sadharanam Samamalam, Sadharana Desha, all the three doshas will be similar. And he tells, Bhumi Deha Prabhedena Deshamahuriyadvida. Bhumi and Deha, they are described as a Desha. Human body and our earth is similar in several things. Visargadana Vikshepai Soma Surya Nilayata Dharayanti Jagaddeham Kapapitta Nilatata. Visarga Adana Vikshepa. That is giving, taking, and distributing. Visarga Adana Vikshepai Soma Surya Nilayata. Soma, Surya, and Anila. Soma means Chandra, Surya means sun, and Anila means Vayu. Soma Surya Nilayata Dharayanti Jagaddeham Kapha Pitta Nilatata. Kapha, Pitta, and Anila, Vayu, are maintaining the body. There, yes, it is vitiating. When it is vitiated, it causes disease. When it is in equilibrium form, it is protecting the body. Vikrita, avikrita, deham, vardayanti, or diseases are there. Gantite, vardayanti. Vikrita, avikrita, deshe, gantite, vardayanti. When it is become vikrita or vitiated, it destroys the body. And when it is in the equilibrium, it protects the body. It is described like this. This is about the doshas. how doshas are made or how the body is made, this is done by Pancha Mahabhutas. All of you may be knowing Prithvi, Apa, Teja, Vayu, and Akasha. These 5 Mahabhutas and Atma get together and they form the disease. Pancha Mahabhuta Shariri Samavaya Purushaha. Pancha Mahabhuta and Shariri or Atma, when joined together, they have formed the body. Similarly, there is one more thing, that is, one more definition is there. Chaturvimshati Tattva Purushaha. That is, Moola Prakriti Avikriti Mahadadya Prakriti Vikriti Saptaha Shodasha Vastu Vikaro Na Prakriti Na Vikriti Purushaha. This can be understood by all the scholars, I think. Therefore, I need not describe because time is also very short for that. Yes, Moola Prakriti Avikriti Mahadadya Prakriti Vikriti Saptaha Shodasha Vastu Vikaro Na Vikriti Na Prakriti Purushaha. Here, very important part I will describe. That's Pancha Jnanendriyas. Pancha Jnanendriyas we are having, that is, it is formed by Pancha Mahabhutas. That is, Prithvi, Ap, Teja, Vayu, and Akasha. Prithvi Gandhabhu Ishtha, it is described, or Gandhavati Prithvi. Our Jnanendriya is formed by Prithvi, and Rathanendriya is formed by Ap or Jala Mahabhuta, and Teja. From Tejas, Akshihi or Chakshurindriya is formed by Teja and Teja, Vayu, Akasha. Vayu. Twakindriya is made up of Vayu and Shravanendriya is made up of Akasha. These 5 Mahabhutas, they form 5 Indriyas. And from that, only we will get Shabda, Sparsha, Rupa, Rasa, Gandha, the Pancha Tanmatra and Panchendriya and Pancha Mahabhuta, they have got the relationship. That is about Pancha Mahabhuta and our Indriyas. So one more concept is, Vayu is formed by Akasha and Vayu Mahabhuta, Pitta is formed by Agni Mahabhuta, and Kapha is formed by Prithvi and Ap Mahabhuta. Therefore, whatever treatment we do, that is based on Pancha Mahabhutas. But by the permutation and combination of these Pancha Mahabhutas in different forms and different proportions, whole universe is formed, all the medicines are formed. Therefore, when he describes about the medicines of Ayurveda, there is a concept regarding medicines of Ayurveda like Sasyajanya Aushadha, Pranijanya Aushadha, and Khanija Aushadas. 3 things are told. Yes, Jangama, Stavara, and Khanija. All the Aushadhi Dravyas are basic or things or raw materials, in other words, we collect from the universe, from the Prakriti or from the nature we collect. For collecting also, he has given some scheduled time, place, etc. According to that only, we have to collect the medicines. Some to be collected in winter, some to be collected in summer, and in some other seasons. It is described, Shushka Atra Dravya Sangraha Vidhi, that is a system in Ayurveda. According to that only, we have to collect. At that time, the gunas, rasa, viraya, vipaka, and prabhava of the drug will be different in different season. Seasonal variation we can see, and we can see the variation according to the agroclimatic condition also. That is also described very nicely in Ayurveda. These are the fundamentals in collecting the medicinal plants. And whenever he tells about to collect the root of a plant, you have to collect the root only. The root has got a different action and shoot has got another effect. Which part we have to collect means, in Sasya Ushada, he tells Panchangas, the root or Mula, second one shoot or Kanda, and Patra or leaf, flower or Pushpa, and Phala or fruit. These 5 things we can collect from the plants. Apart from these niryasas, we can collect or dugdha or latex we can collect. These are the things which we can collect from the plants. Similarly, from the animals, we can collect the milk or milk products. The dung we can collect, the urine we can collect, and the horn of the animal we can collect, the shell of the animal we can collect, and we have to process it. The processing is very, very important. It's called Shodhana and Bhavana work. We add something and we change its property. It can be changed. The property of the medicine can be changed with several measures. It does sometimes to heat, sometimes to put under the soil, or put in the water, put in the milk, or put in the cow dung, put in the cow urine, etc. One example I will tell you. The Strychnus naxomica or naxomica or kupilo, what we call it, it's deadly poison. We have to put it in the cow dung and keep it for 7 days. Then you have to put in the cow urine and take it. And afterwards, we have to boil it with milk and we have to fry it with the ghee. Then it will become all right. One example I will give you. If you give this Strychnus naxomica or kupilo fruit to the cow will not die. Cow will not die. The seed will come from the dung. And if you collect the seed which is there in the dung, it is similar to the seed which we have purified with the cow dung, cow urine, cow milk, etc., and cow ghee. Similar work we can see in the stomach of cow. Therefore, cow is a live laboratory for us. It's very important. Such things are there. Several things are there. This is one example I am giving. Then some minerals, deadly minerals, like arsenic and mercury, etc., we use in the medicine. They are called rasaushadis. We purify it, we mix it with some other things, other vegetable origin or herbal origin things, and we form medicines. This is about some mineral medicine. This herbal, mineral, and animal medicine. In one context in Ayurveda Subhashita, I have studied Amantram Aksharam Nasti, Nasti Moolam Anaushadam, Ayogya Purusha Nasti, Yojaka Tatra Durlabha. This is the example. Any poison, anything, when it is changed or when it is made some gunantaradana or samskara, from the samskara, anything can be changed. A man can also be changed, a plant can be changed, a mineral can be changed, animal origin medicine also can be changed by samskara. But samskara is very important in Ayurveda. Samskaro hi gunantaradhanam. In the guna, some difference can be brought by samskara. This is described in Ayurveda. Then, coming to the different aspects of treatment, this medicine is divided into, medicinal system itself is divided into Ashtanga Ayurveda. That's Kaya, Bala, Grahordvanga, Shalyadamshtra, Jara, Vrishani, Atta, Vangan, Chikisaha, Kaya, Bala, Graha, Urdvanga, Shalya, Damshtra, Jara, Vrisha. 8 types of classification or divisions that's done in the medicine. The Kaya Chikitsa means, commonly we can tell as a general medicine, it is for men and it is for women. Gynecology is not separately told in Ayurveda, it is included under Kaya Chikitsa only. Bala Chikitsa means Kaumara Vritya. Very fine, very nicely he has described it. In Ayurveda, Bala Chikitsa includes obstetrics also, not gynecology, obstetrics also. There it is. Garbhopakrama Vijnanam, Srutikopakramam Tata, Balanam Roga Prashamanam, Yetat Kaumarabhutikam. See, Garbhopakrama Vijnanam, Srutikopakramam Tata, Balanam Roga Prashamanam, Yetat Kaumarabhutikam. This is the Bala Roga. Or in another description, Acharya Kashyapa says, Kumara Bharana Dharana Poshana, Dhatri Kshira Samshodhanartham, Duftastanya Graha Samuttanancha Vyadhinam Prachamanartham. That is Kumara Bharana Dharana Poshana and Dhatri Kshira Samshodhanartham, Dufta Graha Samuttanancha Vyadhinam Prachamanartham. This is the description of Kaumara Prutya. There he includes both obstetrics and pediatrics in one particular department. Then Urdhvanga. Urdhvanga means above the neck, Jatru Urdhvanga. There we can see the treatment of eye, treatment of teeth, treatment of throat, treatment of ear. Today what you call otorhinolaryngology and dental science. Otorhinolaryngology and dental science. All are included under Urdhvanga Chikitsa or Sharakya Tantra, we call it. Kaya Bala Grahodhvanga Shalya. That comes Shalya Chikitsa. Shalya means any surgical procedures, anything related to surgery is described as Shalya Tantra. Kaya Bala Grahodhvanga Shalya Damstra. Damstra means Vishachikitsa. Vishachikitsa means if by any snake bite happens or any Visha is getting either plant organ or animal organ poison gets to his body, that is, or a mineral organ poison goes to his body, that is treated according to Damstra Chikitsa. Kaya Bala Graha Urdhvanga Shalya Damstra. Jara and Vrisha very good to special treatments of or specialties of Ayurveda, that is Rasayana Chikitsa. Jara Chikitsa means aging process is to be reduced. How we can reduce the aging process of a man? That is described in Rasayana Chikitsa. And last one is Visha Chikitsa, or the treatment for aphrodisiac work or to get good progeny. To get a good progeny, not only for increasing the libido, but it tells to get a good progeny. Here also in the Balachikitsa itself, he tells, Sarvopakraman Jnanam, the birth of a child should not be accidental and this should be planned, he tells. That is the beauty of Ayurveda. This is Kaya, Bala, Graha, Urdhvanga, Shalya, Damstra, Jara, Vrisha. These are the 8 branches of Ayurveda, which are true today also. We do practice today also. Somebody may be having some confusion whether you do surgery. Yes, we do surgery. Whether you do obstetrics practice. Yes, we do obstetrics practice. Like that. Such things we practice. It is very easy. It is not only science, it's an art also. For example, suturing the deformed ears, suturing the deformed nose, etc. We do today also, in my practice, today also I have done the suturing of the ear, which is deformed, like that. Today, there are in lot of doctors who are experts. They do the surgery of nose, Nasasandaka, Nemisandanaka, etc. We can treat. And wherever not possible to treat, we have to do amputation of the limb, amputation of the finger, etc. But we can treat it successfully with good medicines and surgical practices, which are taught to us by our ancestors, by our teachers, by our gurus, and as described by Acharya Suchrita, Charaka, or Vagbhata, or Sharangadara, like that. Now, Vata, Pitta, Kapha, where they are situated, that also in the a part of fundamental of Ayurveda. Vata, it, according to the Ashraya Bhava Sambandha, Tatrastini Stito Vayu, Asti, it is situated in Astidhatu. Tatrastini Stito Vayu, Pittantu Sweda Raktayoho. Pitta is situated in Sweda and Rakta. Kleshma Shesheshu Stitaha. The Kleshma or Kapha, it is present in remaining all the dhatus. This is called Ashraya Bhava Sambandha. How we can treat the disease? There, once again, he very beautifully he tells, Vriddhi samanai sarvesham viparitei viparyeya. Very simple formula, yes. Vriddhi samanai sarvesham. A person who is in lack of blood means, if you give blood, his blood will be increased. If he is not having sufficient mamsa dhatu, you have to give him mamsa. When his medas is less, you have to give medas. Similarly, all the dhatus can be replaced by other medicines. When he describes about the Shukra dhatu also, he tells Nakrareto Vrishanam Agra Ushada. For example, Nakrareta means the crocodile semen. It is also used as medicine. A person who is having lack of semen or oligospermia. This experiment is done and we have got good result also. There are some researchers which have gone there. Similarly, Majja Dhatu means bone marrow. When it is the lack of bone marrow is there, you have to give bone marrow supplementation to that man. Today also same thing is done. Where there is Asti Dhatu Ksaya, we give Asti or supplements like calcium. Calcium is rich in Asti, we give it. Similarly, Vriddhi Samani Sarvesham Viparitei Viparya. Against to this particular dhatu, what is that? If you give that, it will be reduced. Now, to have a successful, good life, it tells about Dinacharya. Dinacharya is very, very important to save the health. It tells when to get up, what to do, what not to do. That is also important. In healthy condition, all the dinacharyas are told. In some unhealthy conditions, we have to avoid some dinacharyas. Dinacharya, he tells, Brahme muhurte uttishte swastha rakshatam ayushaha. A swastha person or healthy person, he has to get up in Brahmi muhurta. Sharir kintam nirvatya krita shaucha vidihi. Arkanyagrodha kadira karanjaka kubadika nam kaninyakri samastaulyam pragunam dwadashangulam bhakshaye dantadhavanam dantamamsa nabadayan. How we have to brush our teeth, it tells. Imagine very beautifully. Kaninika pramana, or our small finger size, 8 angular length, one kashta should be taken and we have to brush our teeth by that. Similarly, afterwards he tells Gandusha, Kavala, you may be knowing, all of you may be knowing or may not be knowing, anyhow I will describe. Gandusha, Gandusham, Asancharye, Mukhe Purni, Gandushaha. The liquid should be taken to the mouth and filled in the mouth, and you should not rinse it. You should not gargle it. Just filling the mouth with either with water, with some decoctions, or with oil. That is Gandusha. Kavalo Anyata, if you rinse or move the fluid inside or move the kwatas inside, it is called Kavala. Otherwise, it's Gandusha. We have to practice that. Afterwards, it tells about foliation therapy or Abhyangam Achare Nityam. Daily, you have to use oil for the body. Abhyangam Achare Nityam. What is the benefit? Sa Jara Shrama Vataha. It will reduce Jara, that aging process, it will reduce Shrama. Tiredness, it will reduce Vataha. It reduces the Vataroga. Drishti Prasadaha, to increase the eyesight. Pushtiayu, body should be pushti or nutrient. Swapnaha, very good sleep you will get. Sutvak, skin will be very beautiful. Sutvak, Dhadhya, there should be Dridate to the body. He tells it. Abhyangam Achare Nityam Sajara Shramavataha Drishti Prasadaha Pushtiayo Swapna Sutvak Dhadhya Krut. But he tells to whom it should not be. Natyada Vamata Shwasa Kasa Jwarachaddhisetasi. You should not use this oil massage for the person who is having fever and some other illness. This is for indication and contraindication. Both things it tells. That is the fine description of, it is present in Ashtanga Hridaya written by Vagbhata. That's about the some treatment. And Now, he tells about, in Ayurveda only we can get one description of, in anatomy, marma vijnana. There are 107 marmas in the body. Marmas are the vital points present in particular spots in the body. And on hitting that particular part, he will die, or he will get some deformity, or he will get the pain, or slow death, or like that. According to that, marmas classified as Sadhyo Pranahara marmas, Kalantara Pranahara marmas, Vishalyagna marmas, Raujakara marmas, and Vaikalyakara marmas. This is the very important thing which is described in Ayurveda. When we do the surgery, we have to avoid those points, that particular marma points in the body. There are several marmas. For example, one marma I will take. Dhruva Madhye Stapani, in between two eyebrows, there is a marma called Stapani marma. And it is a Vishalyagna marma. Vishalyagna marma means if something hits there, one arrow comes and hits that place, means if you remove the arrow, he will die. If it lives there, with all caution, the arrow is removed, means he will survive. Otherwise, he will die. This is very nicely described in Ayurveda. Similarly, Trimarma is very important. Heart is telling about marma, and it tells Nabhi as a marma, it tells Basti as a marma, and several marmas are there, 107. We will take about 3 months class during first year to the students regarding marma. I have been teaching this particular subject for the last 10 years. This marma vijnana I am teaching to my students. Very good subject. Marmas are the vital points in a particular part of the body. Total 107 marmas are there in the body. Especially these martial arts people, they study the marmas very nicely. In Kerala, there is a treatment called marma and kalari. That's very nicely described. It's a knowledge, traditional knowledge or traditional wisdom of Kerala. There we study about the treatment of marma vijnana or marma chikitsa. That's a different thing, but for your knowledge, just I told about the marma chikitsa. Now, sir told about the COVID and the treatment and this one, Charaka Samhita, Vimanasthan. Very nicely in Charaka Samhita and other Samhitas, the diseases, a few diseases are described. Just the basics I will tell and I will finish, sir. Prasangat Gatsamparshat Nishwasat Sahabhojanat Ekashayyasanashchaiva Vastra Mala Anulepanat Kushtam Jvarascha Shoshachcha Netrabhishandirevacha Aupasargika Rogascha Sankramanti Naran. How the epidemic diseases are spread from man to man and how it destroys whole Janapada or whole society. It said, Prasangat Gatsamparshat Nishwasat Sahabhojanat Ekashayyasanashchaiva Vastra Mala Anulepanat. Diseases I will tell. Kushtam Jvarascha Shoshascha Netrabhishandirevacha Aupasargika Rogascha Sankramanti Naran. This is a small formula he tells. See, COVID is also here. Jvara. It can be spread by what? It is Prasangat Gatsamparshat Nishwasat. By the respiration it will spread. Sahabhojanat Vastra Mala Anulepanat. What beautifully he tells. And in Vimanasthan also, during the treatment also tells about cleanliness of the body. One. Second, he tells how to walk. That is very beautifully. During the COVID, some contribution all the doctors have to do like that. There was a demand. At that time I told, what is told in Ayurveda, Dinacharya we have to follow. There he tells how to walk. Sata patra padatrano vichared yugamatra drik. You have to hold an umbrella in the hand, wear the footwear and walk in the distance, yugatra. No, one yuga means about 6 feet distance we have to keep. It is told in Ayurveda, Ashtanga Hridaya. We can adapt it. I have given this recommendation to the Department of Health, sir. And in Janapadodvamsa Rogas, he tells about what to do. You have to perform homas. He told you have to give charity to the people, charity to the people who are suffering, who are having less money, or who are poor. The poor people we have to help with charity. See what treatment we might have done, but at the end, this charity was done by the government as well as private parties in India, and they performed yagas, yajnas, etc. And afterwards only this COVID came to control. This was described in Charaka Samhita Vimanasthanam. And he has told about the Panchakarmas also there, and I have given the recommendation, but it was not accepted. Anyhow, I don't know why it was not accepted. Like that. Then, regarding the medicine, one thing I will tell and I close. In Atanga Sangraha, which is written by Vagbata, he tells the medicine. 60 medicines he tells as Agriya Aushadaha. Agriya means best medicines, best things. There he tells Mustaparpatakam Jare Trichijalam Rudbhutta Lottodbhavam Lajachardichabhatti Jeshviryam Meheshudatri Nishe. Like that he goes on telling about 60 medicines. For example, one thing, Meheshudatri Nishe, one thing I will tell and finish. That Meha means there are 20 types of Mehas which are described in Charaka Samhita and in Vagbata also. That is today what we call as diabetes. Not only diabetes, several types of diabetes and several types of diseases related to urinary system and the kidneys. He has told. Here he tells Dhatri, Nishe. One is Dhatri means amla or gooseberry, and Nisha means turmeric. Turmeric and amla are the best medicines for those who are suffering from diabetes. Meheshu Dhatri Nishe, it tells. It is accepted all over India and all over the world also today. Today also, if you use Dhatri or Amalaki and Nisha or turmeric in daily users, we will get very, very good result from that. This is something about the treatment aspect in Ayurveda. So, this is about Ayurveda treatment aspect. Now the Panchakarmas, that's Vamana, Virechana, Basti, Shiro Virechana, Praktamokshana. These things are there, and these are called Panchakarmas. According to the time, you have to do the Panchakarmas. For example, in Varsha Rutu, take Basti. In the case of Vasanta Rutu, do Omana. And in the Rutu of Sharad Rutu, do Virechana. If you practice this properly, your body will be cleansed. This can be called a detoxification of body. Detoxification of body will help to have a long life, healthy life, and better life. Therefore, use Ayurveda. Ayurveda should be there in the mind, should be there in your daily food, should be there in your daily practice, and follow Ayurveda principles and make stop now and go for the interaction section. Thank you.
Thank you, sir. Many thank you. So now I request all the participants to have any question. You can ask the
I
question.
have a question, sir. Namaskar.
Yes, sir.
My name is Raj. Am I audible, sir?
Yes, sir. Yes, sir.
Why are these? I mean, probably very name question and a pretty trivial question. Why are these three things, Vata, Pitta and Kapha are called as doshas because their presence is needed in the body, and if they maintain their balance, then we are healthy. So why
Yes.
are these termed as doshas?
Dushanat doshaha. They are vitiating other body parts. Therefore, they are called as Dushanat doshaha. They are causing the disease. Dosha samyam arogatha, rogatha dosha vaishamyam. Whenever they get vaishamya, they should be in the proper proportion in the body. When their proportion is changed, they are causing the diseases. Therefore, it is called as dosha, sir.
So how do we control their proportion?
Proportion we can control with the food and daily dinacharya and rutacharya. According to the rutu, our food should be changed. According to the age, the food should be changed. According to the prakriti, the food should be changed. According to the place where he lives, the food is changed. In the Jangala, one food we can take. In Anupa, same food we cannot take. Like that. According to the place, according to the age, according to his prakriti, we have to change the food. In Ayurveda, the treatment is individualized, sir, not uniform for all the people. Example, I will tell. One person is getting fever. One medicine may be good to him, but the same medicine will not be good to another person. Or the same medicine cannot be practiced to him in some other seasons. This is a system.
Right, sir. But how do we ensure that we are maintaining this balance? And what are the indicators?
We have to check, sir. By Nadi Parisha also we can do. Or Nadi, Muta, Mala, Jiva, Sabda, Sparsha, Drikka, Akriti. Attavidha Parisha we do, sir. When a person comes, Nadi, Muta, Mala, Jiva, Shabda, Sparsha, Drikka, Akriti. 8 types of tests we can do. On seeing the 8 types of tests, we can come to a diagnosis that whether his disease is changed or vitiated or not.
And one more, sir, doubt. I mean, if you don't mind, is there any system of painkillers in Ayurveda? If a person is suffering from severe pain, the allopathy medicine gives them painkillers to make it numb, make the person not feel the pain. So,
Yes,
is there any such kind of upashamana that Ayurveda gives to?
Yes, sir. Energetics are there in Ayurveda, but they are not so powerful as modern medicines. I agree. We have got limitation. Everything has got limitation, sir. Ayurveda has got limitation. Modern medicine has got limitation. We can reduce the pain, but I am not telling that we can completely eradicate the pain.
And why is the system of Ayurveda very slow? Because of which, I think people are a bit skeptical about, consulting an Ayurvedic doctor because, the system is slow. It takes a longer time.
Sorry, sir. Sorry. See, people come to Ayurveda after getting treatment from other system of medicine. At the end, they come. If they come in proper time, we can cure them in proper time. For example, a diabetes patient, in modern medicine also they cannot cure. We cannot also cure it. Similarly, there are some, for example, there is an arthritis or joint pain. If they come in the proper time, we can completely cure the joint pain, which cannot be treated by modern medicine. They may tell the medicine for 2 years, but we can treat them within 6 months. Such things are there.
Sir, apart from Charaka Samhita, Sushruta, and Ashtanga Hridaya Vagbhata, are there any other books that that talk about medicine in detail?
One Samhita is there called Sharangadhara Samhita, sir. One Samhita is called Vaishajya Ratnavali. One Samhita is Yoga Ratnakara. Then Rasaratna Samhitaya, Rasarnava, Rasatarangini. Several books are there. Rasashastra books are Rasatarangini, Rasarnava, Rasamchi Chudamani, like that. And Vaishajya Ratnavali is a book which describes about several formulations. And Yoga Ratnakara is a medicinal book. It describes several formulation, diseases, diagnosis, etc. Books are there, several books. But today, unfortunately, I was working as a professor for several years in a medical college. Today, the students are not reading the Samhitas. They depend on newly edited some books. And very sorry to tell that there are a lot of mistakes in the newly written books. Actually, they have to read the Samhitas.
Right, sir. Thank you very much.
Thank you, sir.
Hello, sir. I'm
Hello.
Purnima, speaking from Bangalore. Sir, you mentioned for Panchakarma different rutus. Can you please tell what is it for Shiro Rachana and Prasthamokshana?
Yes, yes. See, sir, Rakta Mokshana we can do at any time because it is another type of treatment. Rakta Mokshana we can do after Snehana and Svedana, we can do Rakta Mokshana. But Shiro Virechana, if it's Vata dominant disease means we have to do in the Varsha Rutu, it's better. If it's Pitta dominant, we have to do in Sharad Rutu. And if it's Kapha dominant disease, we can do in Kapha, sorry, Varsha, sorry, Vasanta Rutu. Kapha in Vasanta Rutu. Sorry. Kapha dominant means Vasanta Rutu. Vata dominant means in Varsha Rutu. And Pitta dominant means in Sharad Rutu.
Thank you. Thank you, sir.
Anyone?
Yes, sir.
May I ask a question?
Yes,
Okay.
sir. Yes, sir.
With the permission of the Shubhankar Basavji, I want
Yes, sir. You can ask. You can ask the
Acharya
question.
ji, one thing is clear that Ayurveda depend on the Ayurvedic life, on the Dincharya. So on the other hand,
Yes. Yes, sir.
on the other hand, I want to ask you that how it's related to the Dharma Shastra and the Jyotish, because as I belong to the Jyotish Vigyan and I belongs to the Vastu also. So
Okay.
our Acharya said that if you want to use any medicine from the Jadi Booty, then you have to take care about the timing of plucking up the leaves and the what are the Jadi Booties are there. You have to take
Yes.
the timings, nakshatra, you have to take care of that,
Yes,
and
yes,
how to
yes,
use
yes,
it,
right.
and at the time of the and at what time you are making that medicine, then
Yes,
only
sir.
that can be applied to the patient.
Yes,
So
sir.
how it is
See,
related?
yes. I told in short in my talk that Shushka and Atra Dravya Sangraha Vidhi, one particular system is there. How to how to collect the dry drugs and how to collect the wet drugs. For example, Amrita or Guduchi, it should not be collected in the rainy season. In the summer, we have to collect the Guduchi. If you collect the Guduchi in the rainy season, it will not be having the potency or virya of that drug. And similarly, if you want to collect the rhizomes or like turmeric, ginger, etc. In the month of December to January, we have to collect this ginger, turmeric, or other things which are under the ground. Similarly, the flowers, when you have to collect means in the morning times, we have to collect the flowers. And whenever we are collecting the bark from the plant shoot or from the tree, you have to collect it from the north side, not from the south side. On the north side of the plant, it should be collected. And always use the morning times to collect and use good nakshatra and good time for that collection. And wherever diseased plant is there, don't go and collect the diseased ones. It is described. For each and every plant, he has told the description.
Okay. Sir, another question is that diabetes can be cured if the person is suffering from the 2 years. It's
Okay,
possible.
diabetes, sir, diabetes curing is difficult, but some cases, if his pancreas is not harmed completely, we can treat him. I have got some patients, some are cured, some are getting good result by just diet and a few medicines like Dhatri Nishai, I told, the amla and the this one, turmeric, if you give in a regular manner, we can treat it. Similarly, he has to avoid night meals or heavy foods he should not eat. Or Viruddha Aharas. Ayurveda. In Ayurveda, there is a concept of Viruddha Ahara. Some foods cannot be taken together. For example, milk should not be taken along with fish. Fish and milk, if you take together, it will cause disease. Like that.
Okay. Thank you, sir.
Thank you.
Okay. Now,
Yes, sir.
just 2 minutes, sir.
Okay, sir.
Thank you, sir.
Sir, can I
Now,
get any? Oh, sorry.
Sir,
now I would like
not
to
audible.
warmly invited respected Guruji, Professor K. Dharan, he Department of Sanskrit, Pandit University. I request to Guruji kindly present the concluding remarks of the session. Guruji.
नमस्कार प्रोफेसर श्री कुमार जी
Yes,
के
sir.
द्वारा
1 minute, sir.
श्री कुमार जी के द्वारा हम लोग अनुग्रहित है। इसमें 2-3 बिंदुओं पर हमारा माने वक्तव्य होगा, हमारा ध्यान होना चाहिए। पहला बिंदु यह है, श्री कुमार जी जो कुछ यहाँ पर प्रस्तुत किए हैं, जो प्राइमरी सोर्स का मतलब है जो संस्कृत का जो मूल ग्रंथ है उसका अध्ययन करके उसके द्वारा उन्होंने यहाँ पर प्रस्तुत किया है। इसके लिए उनका जितना भी हम लोग धन्यवाद देंगे वो बहुत कम ही रहेगा, क्योंकि ऐसा आयुर्वेद का जो विद्वान है संस्कृत के मूल ग्रंथों के साथ बताने वाला अति विरल है। आज हमें मालूम है। उस अंश में प्रोफेसर श्री कुमार जी तो अग्रेसर है, और इसलिए उनका हमारा जितने भी पार्टिसिपेंट्स हैं उनके पक्षतः और मैं व्यक्तिगत रूप से उनका हम लोग नमस्कार करते हैं, उनको नमस्कार करते हैं।
नमस्कार।
और उन्होंने जो कुछ जैसे पंचकर्मा की बात है, पंचकर्मा का जो एक चीज का पंचकर्मा में जो एक है उसके लिए 1 साल का विवेचन है। उसमें उसका व्याख्यान करने के लिए वो समर्थ है, उतना हम लोगों को भी उतनी प्यास है, उतना ज्ञान है। यही आयुर्वेद की एक महिमा है। नंबर 2, किसी के जो प्रश्न के द्वारा जब मैंने अपना जो प्रस्ताव रखा, सर का जो श्री कुमार जी का जो उत्तर रहा है, जो आहार शुद्ध आहार के बारे में जो बताया था, वस्तुतः उसमें ये दिया हुआ है, आहार शुद्धो सत्व शुद्धि सत्व शुद्धो ध्रुवा स्मृति है, ऐसा करके आयुर्वेद में इस उपनिषद वाक्य का उसमें वहां पर संहिता में उद्धृत किया है। और आहार 3 प्रकार का जो आहार कैसे दूषित होता है, वह दोष क्या है, ये सब हम बताएंगे तो बहुत समय लगेगा, लेकिन इन सब पर हमारा तो ध्यान होना चाहिए। आयुर्वेद एक ऐसा एक सामान्य ज्ञान नहीं है, वो वेद जैसे अपार समुद्र है, अगाध समुद्र है, वैसे ही उसके बराबर है। आयुर्वेद भी एक सागर का है। इतना ही नहीं, इसमें कुछ लोगों का ऐसे एक संशय होता है, आयुर्वेद में तो हमारा ये चिकित्सा तो सफल होगा नहीं होगा। माने बिल्कुल उन्होंने बता ही दिया है, 100% सफल ही हो जाता है। लेकिन ये है, हम लोग कहाँ पर है, हम लोग आज हमारी जो दिनचर्या है फास्ट फूड के चक्कर में हम लोग है। हर चीज आज परीक्षा देना है और 1 घंटे के बाद उसी ऑनलाइन में हमारा परीक्षा फल निकल जाए, खुश हो जाएंगे। दूसरे घंटे में कहीं पर अप्लाई करना है, कहीं पर बैठना है। इस परिस्थिति में हम हमारा जीवन यात्रा जो चल रही है, जो रोग का जो निदान भी उसी तरह हो, माने कि ऐसा नहीं होगा। आयुर्वेद आपका शांत रूप से आपका जो निदान जो उपाय बताता है, दोबारा दूसरा जन्म हमारा नहीं होने वाला है, दूसरा जन्म होने पर भी आपका वह रोग पुनः आपका नहीं होगा, उसकी गारंटी वो देती है। हम लोग कई जगह पर उसको देखे हैं, स्वानुभवी भी है। लेकिन हमारा विलंब के लिए हम तो सक्षम नहीं है, दोष हमारा है। हम अपने पास जो दोष अपने पास रखते हुए हम आरोप करते हैं, आयुर्वेद से ये ठीक होगा क्या, वो ठीक होगा क्या है। क्योंकि आयुर्वेद में 3 प्रकार के जो चिकित्सा पद्धति बताते समय तो सबसे पहला ये भी एक बताया है, दैव व्यपाश्रय करके। इसका विश्लेषण करने के लिए मैं अभी तैयार नहीं हूं, सबका जाने के मूड में है, ठीक है। माने इस तरह का दैव माने हमारे जो जीवन यात्रा आपके जो कुल्टी कॉलेज के प्रिंसिपल ने सबसे पहले प्रस्तुत किया, कल्चर से जुड़ा हुआ है हमारा आयुर्वेद विज्ञान है। अब हमारी जो सामाजिक संस्कृति, हमारी जो संस्कृति है, कल्चर है, उसके साथ 100% जुड़ा हुआ है आयुर्वेद है। लेकिन एलोपैथी ऐसा नहीं है, दूसरी जो पद्धति ऐसा नहीं है। इसलिए इस तरह का जो कई सूक्ष्म ज्ञान का जो भंडार है, जो आयुर्वेद है, उसका एक लवलेश, उसका एक बिंदु को लेकर इतना बड़ा संकेत संक्षिप्त समय पर डॉक्टर श्रीकुमार जी यहाँ प्रस्तुत करके हमें अनुग्रहित किया है। वस्तुतः उनके लिए जितना भी हम लोग आभार प्रकट करें, वस्तुतः वो बहुत कम है। बस इतना ही हम लोगों का निवेदन है। हम लोगों का ऐसा एक रोग है, माने इस तरह का जो अज्ञान रूप रोग है हम लोगों का आयुर्वेद विषय का। इसलिए जब भी उससे ज्यादा पीड़ित होंगे, आप अवश्य इस तरह का जो व्याख्यान के द्वारा हम लोगों का जो अज्ञान रूप जो रोग है उसको दूर करने के लिए आप तैयार हो जाए, उसके लिए भगवान आपको अनुग्रह करें। यही आपसे हम लोगों का समग्र जो अभ्यर्थी लोगों के पक्ष से मेरा भी निवेदन है। और ये मेरा प्रणामांजलि के साथ मेरा दो विराम तो मैं लेता हूँ। नमस्कार सर, श्री कुमार सर।
नमस्कार नमस्कार।
हाँ
Thank you.
गुरुजी प्रणाम।
Thank you.
सत्य प्रकाश पाठक।
सत्य प्रकाश मुझे मालूम है।
प्रणाम आपको।
हाँ नमस्कार।
Thank you, Guruji.
हाँ thank you.
Okay. Thank you, everyone. On behalf of the Department of Sanskrit, I express my heartfelt thanks to Shrikumar sir, Dr. Organised sir, Guruji, and all the participants and principal of Kulti College. So now, by the Shanti mantra, we'll complete the today's session. Om Sahana Bhavatu Sahano Bhunaktu Sahaviryam Karavavahe Tejasvinadhe Tamasma Vidvishavahe. Om Shanti Shanti Shanti. Okay. Tomorrow we will start same time the session. Thank you, everyone.
Thank you, everyone.
Sir,
Thank you,
what
sir.
about the attendance sheet, sir?
Automatic attendance I'll share the
In the
Google
WhatsApp group, sir?
attendance. Yes, ma'am. Yes, ma'am.
Okay, okay. Thank you. Thank you.
Okay.
Dr. Basavji,
Yes, sir. Tell me, sir.
so Shivankaji, a query a lot of people have right now, that the recording will be shared or not?
Yes, sir. Yes, sir. I'll share the recording, sir.
Okay, thank you.
I'll share, sir.
Okay, sir. Thank you. Thank you, sir.
Thank you,
Thank you,
sir.
sir. Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you. Thank you.
Thank you, sir. Pranams.
Pranam, sir.
Thank you,
Thank you,
sir.
sir.
Thank you so much.
Thank you, sir.
Thank you, sir. Nice workshop. Thank you, sir.